almost 12 years ago when I retired as geriatrics from geriatrics. And I thought that I had seen the other side of darkness. And I was like, okay, I gotta, whatever is the answer, this is not.
Yeah, this is not what it's supposed to be. Yeah, exactly.
It's not supposed to be, the aging can't be this terrible and this bone crushingly real and disappointing. So I was like, I definitely, like, what can I do today for myself that I don't end up like this? That's how my journey started into aesthetics, which is a long time ago, and I've never looked back. Please welcome. This is Dr. Din, and I'm here with my girlfriend and a fellow aesthetic journeyer into longevity medicine. Dr. Kerline has an office almost how many miles away from me? Like 20 miles?
I would say probably 20 to 25
20
miles,
to 25
in
miles
northern
away.
Westchester.
And you do exactly what I do in a different part of Westchester.
You're the queen of the South, and
yes, exactly.
Hopefully
the
at
queen
some
of
point
that
I'll become exactly.
Listen, we're all on this path of learning these new things, and that's what we were talking about earlier, that this is an out-of-pocket, just like it is an out-of-pocket expense for people to obtain these treatments. Similarly, for doctors, it is an out-of-pocket expense, educational expense, to go train ourselves and then experience further learning by treating people over a period of time. I ended up starting almost 12 years ago when I retired as geriatrics from geriatrics. And I thought that I had seen the other side of darkness. And I was like, okay, I gotta, whatever is the answer, this is not.
Yeah, this is not what it's supposed to be. Yeah, exactly.
It's not supposed to be, the aging can't be this terrible and this bone crushingly real and disappointing. So I was like, I definitely, what can I do today for myself that I don't end up like this? That's how my journey started into aesthetics, which is a long time ago, and I've never looked back.
Yes.
And anytime I have felt disappointed on this journey, I go and spend time in a nursing home. And I sit there and remind myself why I ran away.
Gotcha.
From there.
Yeah.
So because it was so despair, the amount of despair you experience in a nursing facility, and because there's no way out unless you're the only way out is by dying.
Yeah, absolutely.
So you're just waiting for death, and that was so depressing, and totally the burnout is real in those fields. So today I want to. So that's my journey. This is what I talk about every time I come. My followers and stuff, they hear me speak about this, like how I became who I became, how I became their favorite tailor, or I call myself a skin tailor. I became a skin tailor, but just yesterday I was thinking to myself, no, I'm not a skin tailor. I'm a gardener. I place the seeds of collagen under your skin, and I become like a gardener, and I wait for it to grow. Then I give it nutrients and stuff for it to grow and keep itself together. So I'm a skin gardener.
Yeah, because you're helping to cultivate the best aspect of that person, to bring it to the surface, right?
Yeah. Like there's manifest your code.
Exactly.
I call it manifesting your ancestral code.
Yeah.
Whatever is in your code, what your skin is, what your color is, what your expression of self is. You're representing thousands of ancestors that came before you. And every code is very special as far as I'm concerned. That's my belief, that every code is very special and it has a purpose. And our job is to help you stay together so that you can fulfill that purpose.
Yeah.
Whatever that is.
Yeah.
So
in a nice, to have that soul of yourself be able to manifest, but to make sure that this this part, the body, what you're running in, make sure that that is at optimal shape. Right?
Yes, exactly. You can't control how life happens to you. So a point might come in your life that where your wisdom and your experience has aligned, and and suddenly your purpose reveals itself to you. You don't want to be disintegrating at that point.
Yeah,
a lot of people.
100%.
My system is about to I see people sometimes in their 70s, for instance, and suddenly I feel that light is about to hit them. However, they're not ready for it.
Their life experiences have culminated to a time now where they can sort of flourish what they've learned, what they've accumulated, their experience, and now they're
now they know themselves. Now they know the other. Now they can see how it's gonna pan out.
But that car can't drive.
But you can't drive.
That car can't
go
drive
from
anymore.
point A to B at this point.
Absolutely.
Because you're about to either lose your mind, or you're about to lose your spirit, or you're about to lose your body. However, for their mind-body complex to last through the entirety of your lifespan in a functional state is the journey. Like that's I think the purpose of somebody like me. Like that's what I consider my purpose, that how to help somebody keep it together for as long as possible.
Not even keep it together, but to get out of the early period, like to get it to flourish, and then to keep that whole engine running as smooth, like you were saying for geriatrics. Even as like for ophthalmology, as an eye surgeon, most of my patients are very, very, they're seniors, right?
So please, can you tell, before you speak, please tell us your story. Like I would like to know what you do, because I know my folks would love to hear what, like, I know what she does, but guys, I want you guys to hear.
I'm an eye surgeon and physician, right?
Yeah.
So I take care of ocular diseases and eye surgery, and most of the ailments that affect us when it comes to our eyes, a lot of them start to manifest a little later on in life, right? So because of that, my population is an older population. So some of the things that you were telling me, or you were talking about, really resonate with me. But to take myself away from that, I think for me, being a physician, it's not just about not being sick, but it's also about being well. So I've always been into keeping our external body like as up to par as possible. So I was the person who back in the day that was like doing colonics before it was a thing, or just always looking for ways of being healthy as possible, right? But also, there's the other side of me that also likes to present very nicely, right? Something that I've been always taught is that this is your calling card. You're coming face to face to present the best person that you possibly can. So aesthetics has always been important to me as well. And I think when I had my practice, Hudson Ophthalmology, I was developing that as a solo physician because I don't work for a group. So I'm on my own, right?
Yeah. That took, just that is courageous.
Yeah. That's every day I'm like, oh. But that took a while for me to get that sort of moving and whatever. And I've always liked the beauty, the aspects, the aesthetics, right? And I would take my classes and then I would never put it to use. Because as you know, once you start taking your classes, then the next is that you need to be able to do it, right? So if I'm taking the classes and then I'm doing eye surgery, I'm taking the class and I'm doing more eye this or that, or ocular this, or I also teach and doing all these other things. It never enabled me to have the time to do the homework. And it wasn't until my kids had gotten to the point where now they were graduating high school, they were going on to college, that I was able to take a little bit of that time now and say, I gotta
put this, all this
I gotta do this. I gotta do this, right? So, and now like
So you were interested in, how young were you when you started learning
aesthetics?
The aesthetics.
I would say I took over my practice in 2010. So as soon as I started that, I started taking my Botox courses and my filler. But then, I would come back to my office, and then you have, your glaucoma, your macular degeneration, all these other bigger things. You're not going to, but, I feel like now it's just like that calling, and now having more time because my kids are independent. I'm, at some point we talked about parents earlier. So, my mother, she passed on about, 3 years ago. Once again,
more time.
Right. Because we're that sandwich generation of parents and kids.
Yes.
And
are we special in any way? Because I think previously also people looked after their parents as well as their children. But I think we are doing it more. We're babying our children more, and we're taking care of parents more also, I guess.
100%. 100%. Well, I think that parents are living longer, right?
Yeah.
So,
and kids are taking longer to mature.
Right? So between that, you're right. We're the sandwich generation in between, right?
Because, like, we're longer generations.
Yeah.
Meanwhile, our youth is shrinking.
Yeah, absolutely.
Because
we finally get that, that freedom much later in life, right? And even some people who are even maybe slightly a little younger than us, they're starting families a lot later.
Yeah.
Right?
Yeah, everybody's like, I know so many girls who just freeze their eggs now. They're like, we haven't found the right partner.
Yeah.
Who's going to partner with us.
Yeah. And unfortunately, it takes a while if you're here in this country, depending on what you consider to be a level of success. But for women, if you're looking to do certain things, that's time investment.
Yeah.
And then, we've talked about fertility is just a finite period of time.
Yeah, exactly.
Right?
And again, that's also increasing the length of time that you will remain fertile. Is like now you have more agency because you can save your eggs, and your eggs are nothing but codes that your body is generating. And the possibilities that your body is generating, and you want to generate a good code for yourself to, send forth.
Because there's a lot more transcription errors as you get older.
Yeah, exactly.
Those codes are not as crisp as when you're younger, right?
Yeah. You'll have to, maybe we'll need a CRISPR for the fertility genes.
Yeah.
So that at some point how to take away codes that are erroneous, because they're just going to, manifest results that may not be suitable for life. Because, life has to be experienced in its entirety with health and wellness and, hopefully also beauty, or find beauty in whatever you have.
Exactly.
That's one of the things.
That's the thing. I feel like one of the things about what we do is that when we talk about wellness and beauty, and as soon as you said the word beauty, it always comes out. Sometimes it's considered a bad word, right?
Yeah.
Because it's considered almost like superficial, right? Yeah. But it's not, beauty is how you define it, right? It's being your true self. What is your true potential and your true capability? And are you able to bring what's inside to the outside to the most that it can possibly be, right? Yeah. And if we can help with that process, right? I mean, I don't know about you, but I find this to be fun.
Oh, yeah.
The people are happy, they're fun, they're motivated, they have an idea, and you help them come in and you help them bring that as much as they want for you to be in their journey, right? Some people want you to be only so much or whatever, but it's just it's something that they're passionate about, and we get passionate, right? Because,
I feel that beauty is just another expression of self, of each chord when it has blossomed. And
I like that.
Every chord that is born has moments when it blossoms, and what we do is that help you stay connected with that version of self for a much longer time. Because normally organic beauty is like a banana. It's gonna wither away in a few years or months or whatever, because everything is perishable. Beauty is a perishable item. So with a little bit of help after a certain point, because what I like, I don't know about your ideal client, but I tell that my ideal client is a menopausal, perimenopausal, postmenopausal female who is pausing. And menopause spells a pause for your beauty also. And your beauty faces one of the biggest obstacles in the path of your beauty will be the pause. And sometimes that pause can happen with childbirth. For instance, sometimes women disengage with their beauty after childbirth because they just can never go back to the person who they were. Many times your woman will go back, when you're younger, if the childbirth was when they're younger, so they may be able to reclaim that connection with their old past selves. However, for most women, that connection is lost, and that unless somebody helps them go back to that with diet, with exercise, with sleep, with some nutrients, some medication, something tightening, whatever
supplements or whatever
is needed. Every human is different. Every human is different. And their deficiencies are different. It's based on what they have been feeding themselves. What they have been feeding themselves orally or any otherwise. That is that. But so beauty is like that blossom that once you get to it, how do you keep it for a little while longer?
Yes.
Hopefully for as long as you can. But however, it is expensive. It's an out-of-pocket expense. Beauty is not a dirty word. Vanity is not a dirty word. It may sound dirty, it may sound superficial. However, beauty is just the tip of that iceberg. The iceberg is made up of all the health and wellness protocols that you can think of.
Yeah, I agree.
From old wives' tales to new science, whatever people will incorporate in their lives on a day-to-day basis, and that those protocols will eventually result in their connection with that beautiful blossom that they are. It will just stay connected longer. So if you feel that somebody has, for the last 20 years, you're viewing someone and that person is just becoming prettier and prettier and hotter, don't just think that that's some superficial shit. That means that person, what you don't see behind the scenes,
something good is happening.
So many things that that person is doing. You may be seeing that little flash of a glowy skin. And that's not all makeup. Meet a supermodel someday. Go meet a supermodel and see what they do. How much nutrient care they give into, how much, how disciplined they are
about certain things.
No, you don't become a supermodel unless you're very disciplined. First of all, nobody will consider you a supermodel unless you have stayed on that throne for like a decade. You're not even considered. You are only considered a supermodel if you've been there for you stayed your ground for 10 years. So if you don't have good living habits and life habits and things that you do
drinking,
on your
water, sleeping, all those
everything if you don't take care, your system will fall apart. And that's what normally happens to most beautiful, when we look at somebody who's just pretty but not healthy. You can be pretty and not healthy, but then you will not be pretty for a while, for much longer.
100%.
It will leave you. It will leave you. And that's one of the things. It's very transient. You'll be like a banana. That's what I like to say to myself.
That can only happen in youth, right? Because youth is more forgiving.
Yes, youth is when your body is still producing the miracles of being young. So everything is working. Your body is creating fresh collagen. Today you destroyed it with alcohol and smoking. Tomorrow, when you go to sleep, it will come right back. It grows right back. It's like chopping a young tree. It'll grow back. You'll come back next day and it's grown again.
But only to a certain point.
To
right?
a certain point.
In the 30s. That's it.
In your 30s and 40s, things start slowing down. And then the perimenopause and menopausal times is when the obstacle bath becomes it's a pre-programmed pause which is set in everybody's body, where your body is supposed to eject itself out of the matrix of reality and life and fertility
I love
and beauty.
But it's
And
so
sanity.
sad how many people allow for that trip to happen.
The thing is that it was just our lack of understanding, I feel. It's that understanding is changing. For your and for our generation, that understanding is
It's
becoming
getting better.
deeper.
Yes.
I think it's because women have become more vocal and we're like talking about our symptoms.
Yes.
Our mothers, our grandmothers
We've never been
mentioned
talking about any hot flashes or
what hot flash.
Yeah,
I'm fine.
yeah, exactly. Right.
What sleep issues, what urinary incontinence issues.
Yeah,
That we never heard our moms complain, but we are complaining.
Yeah,
we're complaining. So the doctors are learning more and they're addressing it.
Yeah,
and now there
we've
are
made it so important.
Yeah,
right?
Because it's important.
Yeah.
Like menopause is a very important phase in a human life. There's this lady, I think you also met her, who was a gynecologist, and she was mentioning, and she works in the menopause life of she's an expert in menopause. And what she was saying is that almost women basically spend now 40% of their life in postmenopausal state of being.
Well, that makes sense, right? Because
we're living twice as long as our ancestors. So we're living post-pause for 30, 40 years. And we're living a life of quiet misery and suffering.
Because we weren't addressing it.
They're not addressing. And even when they did go and address to some guy, like, when they would go to a male doctor or somebody, say that I have my sleep is ruined, my gut is ruined, my beauty is ruined, my hair is falling, my body is hurting.
Yeah.
He would be like, lady, you got to go take a glass of wine.
Really.
Here's some Klonopin. Here's some diazepam or Ambien for your sleep. Here's, a Colace for your constipation.
The way I feel like it was sort of treated is if our goal here was only to produce and have kids, and then after that, you could just disappear.
You're very right. I think that's exactly how it is, that, they basically thought that menopause means the pause of your period, menstruation, and now you can no longer have children.
Yeah.
However, the fact that menopause is an all-system pause, and it's like a constellation of symptoms for a woman's body, was something that I think a lot of doctors just didn't, connect all the dots.
Yes.
And basically women, a lot of the earlier generations are the generation ahead of us, they basically were gaslit by so many doctors by saying that, no, there's nothing wrong with you. All the labs are checking out fine.
But they weren't looking at the right labs, right? They weren't looking at hormones. And hormones, as we know, are the major signaler of almost everything that we have going on, right? It's neurotransmitters and hormones.
Exactly. But even the hormones, they would not indicate, but even the usual routine labs that you look for women, it may be completely fine, and you may still be having all the symptoms.
You're not looking at the right labs.
Yeah.
Right?
Yeah.
We've been skewed to look at a CBC and a SMA, electrolytes and blood count. And if those are okay, and then we sprinkle a little thyroid on it recently to be a little hip, right?
Yeah, exactly.
And that's it.
Yes.
Right. But what about everything else? What about your vitamin D? What about everything, all the other things that's important for us to know about?
Yeah. But now they're doing it. And now, even if the labs look normal, but your symptoms, you have symptoms where nobody is going to tell you that, you're okay. It's all in your head. Perimenopause, if somebody is complaining that, I'm in a slump, a woman is in a slump, there's lack of energy, there's muscle aches and pains. What do you do?
It's funny that you say this, because I have a good story for you. So I had an OBGYN. She was really, really great. Loved her. She helped deliver my twins and all this other stuff. Okay, fine. So I remember when I was in my 40s, right? It was very early 40s. And I said to her, I am not feeling right. I know something, it's taking me a little longer time to think about things. And I'm I'm a little down. I don't have the energy, a little more fatigued, a little down. I was telling her these things, and I said, I think I'm becoming like perimenopausal, right?
Oh.
And she laughed because I'm a very funny person.
Oh, really?
So she said, "Oh, Kerline," and I said, "Yeah, I think I am." I said, "Can we take my hormone levels?" Right? And this was like a while ago. People weren't just taking hormone levels.
No,
levels, right?
Yeah.
And if you're not having another baby, why is anybody taking your hormone levels, right?
Exactly,
And I was about 41, I remember, and she said, "You know what? I'll take your levels, but I'm telling you, you're being so silly." Right? So, and she says, if you want to predict how, like, when you're menopausal or perimenopausal, ask your mom and she'll tell you when she, like, when her period was gone, and you'll see how far away from now it is, and you'll, whatever. But anyway, Kerline, you're so funny. Fine. So I'll never forget, I was heading into the, like, parking lot of the hospital, and I get a call from her. And she's like, I'm so sorry. You are deep into perimenopause, deep. Like, I was like, and literally the very next day I asked my mother, and I said, when did you lose your period? And she said, oh, I think it was just like right after you were born. And I was born, I was 30, she was 38 when she had me. So it was, it wasn't crazy, right? And this was this was a woman. Right? And I think that we tend to ignore women. We know our bodies, right? And it was very, very interesting. So I ended up, like, eventually getting HRT, and it made such a big difference. Really. Totally difference.
Well, and this is, you basically self-diagnosed. Well, that's what you're saying, that you went to a female GYN and basically self-diagnosed yourself.
Yes. Yeah, I did. But I had to advocate for myself too.
Exactly.
Right?
And that your advocacy came out of this long period of not only educating yourself, you're like, a medical doctor, an ophthalmologist, an eye surgeon, all these things, and then going through it by yourself.
Could you imagine what other people are going through?
So exactly. That's our point, that imagine somebody who did not know this or was not as aware. You've learned the human body. You've done these rotations.
Yeah. And I know, but people still know themselves too. And you should give that, I mean, what is a blood test?
The thing is that it is a blood test. However, if people have to pay out of pocket for tests, many times insurances I've seen will not cover a test
without an indication. Right?
So and that is an indication that should check in with the ICD-10 code or 9 code. Right? So we used to go and find it. Is there an indication? So unless it is a code, we can't even insert it to get the blood test. So if you it has happened because I used to do primary care for people and geriatrics for people. If it is not in the system of codes, and we don't send those to the laboratories, you'll have to pay for blood work yourself out of pocket, and a lot of people cannot afford to.
And basically, what you're saying is that there's no code for let me see what's going on. Right? Right? You need to have a diagnosis beforehand in order to be able to even get the permission to get a test for a patient.
100%.
Right? But how do I have the diagnosis? I'm still trying to figure out the diagnosis. So now you want me to commit and pick an imaginary diagnosis so this person can get their blood work? Or I'm not allowed to say, well, patient is,
Many times for women, unless you place that there is a menstruation, so for perimenopause, there is nothing for perimenopause that we can check. So you have to add that, you have a menstrual irregularity or something for it to be considered, coverable.
Yeah.
Now, they may not have a menstrual abnormality. They may have like body aches or some other symptom. And, that may not, they'll be like, oh, why are you testing hormones for that?
And that's the thing. You need to have a doctor that's not only willing to listen to you, but also has to be savvy enough to know how to pick the right code to get around the insurance BS.
Yeah.
Right?
The loopholes.
Yeah.
Because you get lost in the loophole. Don't get lost in the loophole.
And even when you find the answer, sometimes that answer is going to cost you if you want to do something about it.
Exactly.
Right?
So once you know, and there are certain things that you have to do, like HRT is not covered by your insurance.
Which is insane. Which is absolutely insane, right? That's not covered by insurance.
Yeah. Sometimes estrogen, they would give or whatever, but like testosterone is not. Progesterone is, I think, there's some combination patches they'll give you. But, I think menopausal symptoms should be covered by insurance because it's just a pause an all-system pause for the female.
Unless there's a contraindication for HRT, right? For hormone replacement.
Exactly.
All the benefits that we know about estrogen with the cardiovascular protection, the insulin resistance, and all of the other things, the mentation. I mean, all of it is all beneficial if we're going to be living for a while, right?
Yeah.
We can't be dried up like prunes so quickly. Right? We need these things.
Yeah. Exactly. Your supplementation requirement increases because your system is pausing. So hormone is just one type of supplements, and there are so many other supplements that we recommend for people, like glutathione, like high dose vitamin C, like all those,
magnesium
and stuff. And without getting many of those things, it's going to be hard for women to, keep their hair or keep their systems running smoothly.
And who's going to educate them on this?
Us. Listen, it's Sunday.
I'm so excited that there's a lot more information regarding this.
Yes.
Right? This is coming
I think we're coming to that point in our existence where women's health and all this information is becoming very, reachable. Everybody's getting it because of social media. Sure. Or I think after social media, it's going to be ChatGPT who's going to become your concierge.
It's so true.
You're going to tell ChatGPT that I'm feeling this, what it can be. It's going to say, I think you're perimenopausal according to your whatever age and whatever.
But I'm not willing to commit, and please make sure that you check this with the provider.
So I tell people that please ask your ChatGPT what you have and then go and discuss it with your provider.
Really, honestly.
Because your provider has only 5 minutes to spend with you if they work for your insurance. Because your insurance is going to pay them for 5 minutes.
That's it. That's it.
That's it. So the 5 minutes.
And 1 or 2 complaints. Yeah. Don't come with your scroll of complaints because they're not. Yeah, there's no time for that.
Yeah,
they're pulling the plug on that.
Exactly. Your insurance that hires your doctor will tell that doctor that we're going to only pay you for 5 minutes of your time with this patient.
2 diagnoses.
2 diagnoses max, and that's it. If you have more than that, please
make another
appointment after a month.
Yeah, and we hope that you
that will be
have the ability to ever get to the appointment, and we hope that you don't have transportation and all the other things so we can save money on the other side, right? Make it more obstructive to a person getting the health care that they require.
Yeah. See, healthcare in United States, I've seen, is more like sickness management. So it's a management of illnesses. Healthcare has nothing to do with health.
No, it has to do about getting sick.
When your system is falling apart, what are the things that we're going to give you
to fix it? Yeah, but what about trying to get it so that it's not falling apart?
So that preventative lecture that you need is not covered by your insurance.
You know what? It's so interesting because, I mean, come on, geriatrics and myself, not everybody wants to be responsible for their own health, right?
True.
How many times have you had a patient who's diabetic and when their blood sugar was elevated and you ask them, well, what are they doing about it? And they look at you with a blank expression on their face and they said, well, I don't know. My doctor's supposed to, I guess, increase the medication.
Yeah.
But what are you doing? Yeah. And you'll find out that they may not know because they're not told, or they still feel that a medicine is like this magic elixir to make disease go away.
Yeah.
But at the end of the day, why not fix it so that we can try to manage or eliminate the disease without having to rely on the medicines? And why don't we slow down the degenerative process of the body if we can?
100%.
What are you doing?
Yeah. You have to take responsibility for your health. 100% I agree. And if people feel that a medication is going to fix their problems, they don't. They may put a band-aid on one problem, they may cause two other problems for you on the side.
So true.
So the best way is to prevent the disintegration of your system. And even for health and wellness, like people who now I take care of are the ones, like the only ones who actually will stay healthy are the ones who are proactive about it.
Yeah.
I can't chase everyone.
It's so
We
true.
can't chase people.
We can't.
You gotta, like, it's hard. Life is hard enough for our own selves.
Yeah.
Like, we're doing all the things for our own selves too.
It's so
to
true.
stay healthy and okay. And like, look, Sunday you went for your golf practice.
Yeah.
I am going to go for my whatever, walk and hike or whatever, because to keep ourselves together. So in between we can offer like support of like what are the things that people should be doing. I write about it and we talk about it. But the thing is that eventually health is only for those people who are proactive about it. And if they're not proactive about it, it's very hard for a doctor to come and make you healthy.
They cannot.
It's not something that we can just give you as a gift. Health is a gift you give to yourself by doing the right things.
Yeah.
By doing things for yourself that are good, that are
doing the
useful.
Right things, finding the right doctor for yourself. Right? There's a lot that is conscious on your level, and what are you doing about it?
100%. Dr. Kerline, how can my followers find you? What are the best channels to follow you? Tell us about yourself and also plug your office in.
Okay, so if you're wanting to deal with eye diseases and eye surgery, because I'm a cataract specialist and a glaucoma specialist, then that's with Hudson Ophthalmology, which is my practice in Cortland Manor. Or if you want to pursue wellness and aesthetics, and we've talked about all the devices and all the wonderful things that one can do to enhance and get that glow on the outside, right? All those wonderful things. Then that's with Hudson Aesthetics, and that's also in Cortland Manor. You can find me at Hudson Ophthalmology or HudsonAestheticsMD.com, Instagram, Facebook, all of that.
On Instagram, what's your handle?
Hudson Aesthetics MD. Facebook, Hudson Aesthetics MD. Website, Hudson Aesthetics MD, and Cortland Manor.
Follow her on all her social media profiles.
This is great. We have to do this with it. There's so many other things that we have to talk about. Yes.
We have to.
And I love everything that you do. I follow you so closely, and your humor and your intelligence and everything that you bring.
Thank you.
And
I really appreciate.
You are a very good
it's
mentor.
Like, we're doing the right thing, it's like educating people. And sometimes, when we do it in conversation with somebody who's doing exactly the same thing, is like so important, because people need to know. I was talking to somebody yesterday, and she was like, the couple was like, do you know anybody who does this in our part of the town? And they were in New Jersey. And I was like, actually, I do. and
you gave them a name.
And I gave them a name.
Oh, that's awesome.
And it is like, and because for people, it's very important for them to find somebody close by. That's their person, because it's like having a body shop close by. And you go in, you do your routine upkeep and maintenance over there.
Make it easier for you if it's right up the street, right?
Exactly. And there will be a time that, just like we have sickness management doctors everywhere, there will be proactive health managers also.
Oh, we have, and we need that.
That should be like easily discoverable.
Yeah.
And that's us. So I'm glad I am.
We're promoters of wellness and health.
Health and wellness.
Yeah.
Well, let me quickly see if we have any questions.
Yeah.
We had 148 views. Wow. If you have to give one piece of wellness advice, what would it be? And then, do you see AI as a tool to support doctors or as a replacement risk?
Never a replacement.
It's not a replacement, for sure. Healing of your system requires the touch of human consciousness. So somebody has to come and see you for healing,
Delaying
true
the
healing.
hands.
Yeah, exactly.
The connection. There's a connection here.
Yes.
The
Yes.
human to human connection
Yes.
is very, very important, right?
Yes, and I don't know if robotic connection is going to be enough. It is very important. Robotic connection will be very important
It'll
because
help.
it will help
It'll be a
you
wonderful tool.
gather the data, gather your information, keep it ready so that it can be accessible
Readily.
but readily. But the thing is that it will even tell you what you have. However, to get the access to medication and actual true healing, long-term healing and wellness, you will need a medical doctor. So I don't think doctors are going to be replaceable anytime soon. And what is the one piece of wellness advice? First, you go. What would be your top wellness advice to give if there is one wellness thing that we can do?
The top wellness advice is to keep your stress down, because that is ultimately, whether it's mental health stress or physical stress or people who are around you who may be getting to you, that will cause, people don't realize the mind body connection, and cortisol is real.
Mm-hmm.
And it can be destructive, and it's very, very important. We tend to drive our bodies and drive ourselves.
Mm-hmm.
Oh, I'm strong, I can handle this, I can do this, and I can do that. But that cortisol, the holding of the breath, because we know that when we're stressed, we hold the breath. Less breath, less oxygen, less life for us. So it's that, I believe that is probably the most important wellness tip I can give.
I'll take that for today. And with this, we thank you so much, Kerline, for doing this with me. Thank you for coming on my rebranding of my podcast.
I'm so excited about this.
Yay! Listen, you follow me. See, we're on Spotify, we're on Lipson.
Bathroom Diaries.
Yes. So you're my first guest.
Tell me about the Bathroom Diaries. Why bathroom?
So Bathroom Diaries, and that's why I wanted you to be my first guest for Bathroom, because Bathroom is a place where it's such a personal space for not just women, but I think for everyone, where you are faced with all your problems, where you're faced with the consequences of all your problems. So whether it is from your getting periods or, gastric trouble, how you are peeing, what you're looking like, do you have body dysmorphia, or do you like yourself, how you portray yourself to yourself when you remove your masks of makeup and everything, and how you portray yourself to the world and to the others when you put your armor on. When I say that women use makeup as their shields and their filters. And I call my makeup war paint. I'm like, you would do this, and
I always say that too.
They actually say that there are studies done in where they found that women who apply good makeup and do it daily, they actually get paid more. So it actually results in women, the way you display yourself to the other is also, so it's important. And then how to figure out, so you being an eye doctor, eyes are the windows to a person's soul.
So
it is the part of, eyes are that part of the brain that is actually facing outside. And so we deal with how we view ourselves, with all the vanity issues. Why is it considered a dirty word? Meanwhile, it is not. And beauty, like the perception of beauty or perception of self issues, all of most of our problems arise and get solved in the bathroom.
And I'm gonna. I love how you brought that all the way around.
That's why I called it Bathroom Diaries.
I love that.
So these are this is a page out of my Bathroom Diaries.
Bathroom, I think, is also a body shop, right? That's where we actually take and we are able to sort of do our tune-ups. Right? Our private tune-ups that we need to do.
That's where you realize where on your body you need a tune-up. So if your period is abnormal, you need to know, I need to go see by my GYN. If you're having urinary incontinence, you need to know where you have to go next.
Your stools are abnormal.
Exactly.
You bathe your body, you do your mole checks. All
you
that
go
stuff,
and most people have their weighing machines. I get pressure in their
Yeah.
scales. I tell people that the best time to weigh yourself is in the morning once you've pooped or peed,
Yeah,
and
I
then
do the
you're
same
not
thing.
wearing your clothes,
Yeah.
and I want you to go and weigh yourself and
Yes.
see where you are in time.
How
and
often do you
space.
think you have to weigh yourself?
I personally don't there was a time when I was trying to get to a goal weight, and at that point I used to weigh myself on a every couple of days, but now I weigh myself once or twice a month just to see that I'm normal.
That you're with your,
Yeah,
your
I'm
norm.
once you're in your range, then you should just keep a track of it.
Once you're in your range,
Yeah,
depending on how old
Yeah.
you are, is how
Yeah.
often you should be
yeah,
weighing yourself. There is a period
or
of
how
time
you are
in your
fitting
life,
in your clothes.
but there is a period
Yeah.
of time in your life. I feel that you need to know how food affects you.
Yeah,
Right?
yeah.
Like now I already know. I've been eating sushi for gazillions of years, and sometimes I'm like, well, why am I weight up? It's because of the soy, right?
Yeah.
So now I know just from the daily weighing of myself at a period of time in my life that, if I have this amount, I'm going to be up a pound or two, and that's okay,
Yeah.
or whatever.
Yeah.
So you have to know how food affects you.
Yeah.
I know if I eat a lot of carbs, my weight goes up. The minute I cut back and I drink water, all of a sudden the gut starts to
100% correct. And sometimes weight is a very important indicator of your wellness and health. And during menopause, women experience metabolic slowdown, where they may be eating the same thing and sleeping the same way, but somehow they start pounding getting packing on the pounds, especially in the mid gut area, and that is a symptom of their metabolic slowdown. And that's how you actually sometimes tell a woman that you're almost menopausal, and they would tell you that I've just gained weight and I don't know what to do, and very soon they have to go on high blood pressure medicines and cholesterol medicines and diabetic
I'm going to ask you a
medicines.
controversial question.
Yes.
So do you feel that the slowdown and the menopause and all of that stuff and semaglutide sometimes come linked together? Like, do you feel like along with the HRT prescription, many times people are going to be getting
GLP-1, yes. I actually consider GLP-1 agonists as a supplement for perimenopause and menopausal metabolic slowdown.
You know what? I'm starting to think that the evidence and the literature is going in that direction.
Yeah. It's a sugar neutralizer.
But I don't know what it is that people have this. There's a stigma against these semaglutides. Why do you think it is?
Because
you think it's the skinny people that are upset that
everybody's going to become So listen. First of all, insurance is not going to cover it for everyone. And so it is an out-of-pocket cost currently, and it is a lot of money. So I don't think that you will be able to afford to be skinny if you don't have money. So number one is that
the
price is good. No, metabolic slowdown of menopause is I know women who have struggled, and it's just have you had patients with PCOS? It's hard for them. Life is hard. It's like climbing Kilimanjaro. That's why I say it's like Mount Kilimanjaro.
Look at Serena Williams.
Oh, I haven't seen her.
So she recently went out and told everybody that she lost her weight through semaglutides.
Okay.
And people were, saying whatever.
It's easy.
And she purposely said, I want for it not to be like in the closet.
Taboo.
I don't want people to be ashamed. Because if someone like myself is saying that, I work as hard as I do,
exactly.
and after I had my baby, I couldn't shake off that weight. No one's going to say I'm a slouch and I'm tired.
Exactly.
And, or I'm not doing what I need to do. And she just wanted to do it, sort of empower people to, if this is what you need to get your hypertension down, get your weight down, and control your diabetes,
cholesterol,
control everything, the gut fat, the whole thing, then
fat is like an organ by itself. A fat is
visceral fat.
Not just visceral.
Fat is not good for you.
Yeah, exactly. And the thing is that it shapeshifts.
Yeah,
it goes from your subcutaneous to your liver. I mean, people have fatty liver all the time, and then the poop of your fat cells,
you will tell
which is the cholesterol. which is
gross
the cholesterol.
anatomy.
Yes,
right.
Exactly.
There was a big difference when you had a corpse that was here and somebody had something there, and like if you opened a body of a person who was very like obese, there was
it's everywhere,
fat all over the vital organs.
Yeah, it just like takes over. It's like plastic.
Good.
It's
not
like
healthy.
plastic. Exactly. And then the thing is that GLP-1 agonist rehabilitates your fat cells, and the poop of your fat cells become rehabilitated. And the thing is that fat cells are can become hoarders. Why? Because we're just exposing the industrial food complex is putting so much sugar in everything that we are all addicted.
Putting a lot of sugar and cutting all the fiber. Right? So the food is going right through you. Right? The insulin has no time to toss it out there. Right?
Exactly.
Food's already gone. Right? So it's just,
No, I like we can keep talking.
Oh,
for
we can go on. Yeah, we can go on. Just insulin resistance in itself can be a whole other conversation.
That's a lecture in itself.
Yeah, right.
That's a lecture in itself. Yeah, exactly. But anyway, guys, if you liked what we're talking about, please come and join me again. Listen, I do see the heart sign.
I may come back again soon.
Yeah, she might. She will. What do you mean?
But you need to have other people in your bathroom, not just me. But I'm just saying,
at least the first 10 episodes usually.
Okay, maybe I'll even join you.
Exactly. Initially when I thought of this, I was like, I should go to people's bathrooms and film this.
That's not a bad idea, but I don't know how many people can fit in the bathroom.
I know, nice ones, the nice ones. The huge ones. I have some friends with like really glamorous bathrooms.
I have a good hot tub. Maybe we could do a hot tub.
Oh, diaries. Yes, perfect.
Would you like that?
Good. I love it. I have a date. We have a date. How did we meet?
Oh, that was so random.
Oh my God, that was so random. Okay, so how did we meet? That is like, okay, so it was very...
I called you for a reference for someone.
It was just like a reference call. However,
and then we couldn't get off the phone. I called you for a reference for someone who worked in my Hudson Aesthetics, because you have that vast experience, and they had worked with you. And then we talked about the person, but then we couldn't stop talking. Right?
You were doing something.
Yeah.
I think at that point, one of the things that that aligned was that I had recently lost my best friend.
Yes.
She had passed on, and then you told me, and it was Dr. Loveleen Sood, and then you told me that you had just lost your best friend.
My best friend too.
You had lost your best friend 2 years ago, and I had lost my best friend 1 year ago.
You know what's the funniest thing is that when we went to meet...
Yeah, we met at the same restaurant.
That I used to meet with my best friend all the time. And I was like, this is definitely going to be a friendship.
Yeah, exactly. So we hit it off. And I think the fact that we could have a conversation, extended conversations multiple times over. Yeah. We were like, okay, we're like, our journeys have kind of aligned. Our stories are like coming together. And then, every time I met you, I was like, I like this lady.
And we're very encouraging. I feel like, of each other.
Yeah, we're positive. We're positive people. Yeah. Exactly.
Well, that's another conversation about women and how we need to all work together.
Yeah. Exactly. Yeah, so that's our next.
We have so many things to talk about.
Many things. What is the area of expertise of Dr. Kerline? So she is an eye surgeon who is also into longevity medicine and aesthetics. So she is on the path of beauty. Listen, beauty is the tip of an iceberg, even in medicine. It's like you cannot be, the highest paid beauticians are extremely talented and skilled. They have degrees after degrees after degrees.
And don't forget, I think the other reason why the word beauty is a little sometimes off-putting is don't forget beauty, when we think of the term, is a social construct, right? Because we're starting to think, oh, beauty means this thing or that. And we're assuming that that's what beauty is so many different things. Right?
It's not just the shape of your eyebrows.
It's how comfortable you are in your skin.
Yes. Yeah, exactly. Yeah. It's the confidence of strutting your stuff. Yeah. And unashamedly and unabashedly. Okay, that's good. I think we've answered all
Yeah.
the questions.
We'll have more questions